Want to live a healthier, happier life? Then you may want to consider adopting a pet. Intuitively, you may already have a sense of the joy and comfort of animals, but now there's growing evidence that they can have a significant positive impact on your overall health and well being. Welcome to UT Health San Antonio Wellbeing Wisdom Podcast, a dose of learning for healthier, happier lives, brought to you by the Office of Human Resources. I am your host, Laura Gottlieb, and our topic today is the power of pets, human-animal interaction, and its role in our well-being. We are joined today by our very special guest, Dr. Meredith Stensland. Dr. Stensland is an assistant professor of research in the Department of Psychiatry and Behavioral Sciences with a background in clinical social work. Her research focuses on older adults living with chronic pain, as well as the utility of animal-assisted intervention for pain and depression in dialysis clinics. In her clinical work, she facilitates a psychoeducational chronic pain therapy group. Welcome, Dr. Stensland. We're grateful you're here with us today to share your well-being wisdom on the benefits of human-animal interaction.
Thank you so much for having me.
To kick things off, please tell us a little bit about yourself and your professional journey so far.
Yeah, absolutely. So I was born and raised in Iowa, and I studied in both undergrad and master's to become a social worker, and really kind of fell in love with the research component and decided to go on and get my PhD also in social work. And my overall kind of overarching research interests are older adults and chronic pain and non-pharmacological ways of managing pain. And so, animal assisted interventions certainly fall under that kind of overarching umbrella. And so that's how I've sort of tied those two things together.
I'm curious, how and when did you first become interested in this idea of human-animal interaction and its role in fostering our well-being?
Yeah, absolutely. I've always been an animal lover my whole life. Like I said, I grew up in rural Iowa, and always had animals around, maybe bringing a stray or two home, visiting farms, visiting the farm animals. We had cats, dogs, hamsters. So, in my personal life, they've always played a special role. And even now, just in the last couple years, I've rescued some animals here in San Antonio. And so in my personal life, there's always been that connection, but the connection really got made in my professional life for the first time when I was working in hospice. And so I was actually a hospice social worker for 4 years, and that's when I learned what a therapy animal was. I got to meet a therapy dog and observe a bedside, therapy dog visit with a terminally ill patient and their family members. And I was hooked from that moment. The comfort that it brought the patient was just undeniable. And but even more than that, it was really the effect it had on the family. They were comforted by seeing their loved one be comforted. And in hospice was such a heavy situation as that, it really made a big difference, and it really touched me. And so I can say that was very specifically the point that I thought, wow, I want to do something with this. This is incredible.
It sounds like you have had your own direct experience growing up with animals in the way that you have, and your experience in hospice care. I'm
Yeah.
wondering if you could share with us what are some of the evidence-based benefits of human-animal interaction, some of the research. I'm also very interested in some of your own research in this area.
Yeah, absolutely. I will say too, one other thing I thought of was like when my very first job out of grad school, I was a therapist in a county hospital, and it was like a geriatric psych unit. And so I worked with older adults who had mental health concerns, and I had this idea of, okay, well, maybe I'm not getting approval to bring dogs here, but what if we got a very small fish tank? And that was my first run at really going live with this. And I will say, even just that fish tank made a difference. And so this group of older adults, they engaged in group therapy, and it was amazing. They would show up early. They would miss less appointments. They would go into the group room and hang out and talk with each other. And they would assign each other roles in helping it clean the tank and just discussing, catching up on the latest fish drama of the three living in the tank. And I remember like it really brought out this cohesion in the group that I hadn't seen before the fish tank, honestly. And so I had to throw that in there too, because I remember that being one of the really early experiences that made me think, okay, I'm on the right track here. And kind of building off of those two experiences is when I wanted to really move into the research. And I'm building off of a growing field of research that's trying to look at the evidence-based, benefits of human animal interaction. And it certainly is an evolving field, but we are seeing some trends that it's definitely valuable. It provides benefit, and that's in a lot of different kind of domains. So from a stance of like physical health, they can help encourage an active lifestyle. If you have a dog, maybe it's like you have to get more steps in than you normally do if you're, taking them on a daily walk, or, they're out playing in the yard and you go out there and engage with them in that way. So that can get you, spending time outdoors. And so there's this kind of encouragement of being more active, and that helps, facilitate more health benefits physically and socially too. We see that that's one of the things probably I see that comes up the most recurring in this body of research, is that there's companionship in this human animal bond, and that it's different than maybe what you might get from a friend or a family member in important ways. And it's kind of like this unconditional sense of devotion, or a connection there between you and the animal. Um, and also it can actually help enhance likability. It's almost like this social lubricant that it helps you interact with other people better, and maybe is a talking point, right? And so can maybe lead to some social connections that wouldn't be if you didn't have the animal with you. Psychologically, we know that there's research showing it reduces, subjective pain severity. It can, lower subjective stress, and just kind of elevate your mood in terms of those psychological benefits. And physiologically, that's another one of the robust trends, is that it can actually kind of be a buffer against some cardiovascular risks. And so when you take all of those things together, it's kind of incredible, honestly, the different benefits that human animal interaction can bring us.
Your examples are so on point, and I'm even your first example of the fish tank.
Right.
I remember taking my kids to their pediatrician, and there was a fish tank in the waiting area, and it had this calming, soothing effect on them, and it
Yeah.
gave them something to occupy them instead of getting anxious or nervous about being at a doctor's office. So I can see
Right.
a lot of benefits there. And then I think even before this podcast, we talked about a coworker of mine who kept a fish on her desk in her office,
Yes. Yes.
and how a lot of my colleagues would just pause. And as you said, animals becoming this social lubricant, it becomes a
Hmm.
conversation starter. It helps
Definitely.
facilitate social interaction. And certainly anybody who's been to the dog park has
Absolutely.
probably had a very direct experience of that. And speaking of dogs, I have a question for you. As the founding
Yes.
director of Healing Hounds, could you tell us a little bit about this incredibly impactful program?
Yeah, absolutely. So, Healing Hounds is a program that kind of grew out of my interest in this human animal bond, as well as some of the research, and I can touch on that too, that I completed since coming to UT here. But basically, Healing Hounds it's a collaboration between UT Psych and also a couple local nonprofit organizations who have been absolutely incredible. So I want to definitely give a shout out to TASA, which is Therapy Animals of San Antonio, and Paws for Service. So, like I said, those are both local nonprofit organizations, and we partnered over a span of the last couple of years. And we work with their certified dogs and their handlers, and they've designated UT as one of their sites that they come and visit on a very regular basis. And so they're visiting primarily our patients and their family members if they're accompanying them to the sessions or their appointments down in the waiting room, but they also make rounds throughout our building. And so they're visiting faculty, staff, interns also. So it's not just patients. And this is a program that it started in January 2023. And we had just 3 dogs, 3 pet teams. And by pet team, I mean the dog and their corresponding handler. So we had just 3 teams this was in one small clinic building. And in September of 2023, we actually relocated the Department of Psychiatry. We had all the different kind of locations and clinics all under the same roof for the first time. And it's this very large building. I think it's over 70,000 square foot. And we basically tripled our teams. And in that span of time from January 2023 until basically up to last month, I calculated we have 2,778 visits that the dog handlers have made with patients or families. And that's, like I said, that's not even counting the staff, the faculty and staff visits. So, they're pushing 3,000 visits in the relatively short amount of time that they've been coming here. And it's just been, honestly, it's been really, really fun and really exciting to watch.
I love that you included faculty and staff in that. I am keenly aware, especially in patient care areas, the potential for burnout and the impact having animals in those environments to help people with their own personal resilience and stay in touch with, things that bring them joy.
Absolutely.
So it's great to hear not only do patients benefit, caregivers can benefit. I'm also aware that many colleges and universities have pets rounding on students during exam periods to help reduce
Yes.
anxiety and stress.
I love that. I love that. Yeah. You know what? When I talked about some of the empirical findings, college students are one of the big populations that have been studied, certainly in healthcare settings, of course. But also, like you said, a lot of those instances are maybe end of semester, end of term, kind of de-stressing type events. I know for a fact that one of the organizations, Paws for Service, they have kind of on their website a special events request, right? Where people from the community can go on there and actually make that request. And I know UT has done that in the past. So I think that's a great example.
Yeah, what a wonderful service.
Yeah.
I'm wondering, so you mentioned TASA and Paws for Service and, thinking about dogs that are trained to be sort of therapeutic. What about household pets? What role do they play? And do you have to have a certified therapy dog to reap a lot of these benefits that you've already mentioned?
Absolutely not. Of course, a certified therapy dog is just that. They are certified. They have gone through extensive training, a lot of, very, very good obedience, and kind of meeting some of those different criteria. So that's working with something really specific, but absolutely not. It does not have to be that to get those benefits, right? A lot of the research, while it does focus on, some of those maybe service animals or emotional support animals or therapy dogs, so those different kind of classes of working dogs, a lot of it is also on just companion animals, right? Just good old fashioned pet ownership. And so there is research backing those benefits as well, particularly in older adults. And I know that in the study that I'd led at the dialysis clinic, that was one of the things that I heard from patients a lot is that, I've asked the clinic, I wish I could bring my pet with me. It would make this so much better. Like they want to bring just their basically non-certified pet to the clinic. So there absolutely is ways that it's just a companionship animal providing those benefits.
I think that's a wonderful benefit and nice to know that a pet or an animal doesn't necessarily have to have certification to be beneficial. Are there
Yeah.
things pet owners can do to amplify some of these benefits?
Yeah, you definitely want to, lean into the amount of time that you spend with the animal and maybe, taking care of an animal is a lot of work, but if you're maybe not involved in some of their grooming or, feeding it or their walking, some of those kind of daily things, maybe lean into those responsibilities and you'll find that caring for something like caring for another animal is actually teaches a different type of compassion that sometimes translates back to yourself. It's almost therapeutic caring for something else like that.
Oh, I can see that for sure. What if I'm not a pet owner? I happen to have two dogs at home, but not everybody, based on maybe their job responsibilities, they're away from home quite a bit, or maybe they live in a small apartment space or something that creates some limitations, and they're unable to own a cat or a dog or have a pet at home. So, what are some ways that someone who doesn't have the benefit of pet ownership, how can they tap into some of these aspects of well-being interacting with animals?
Sure. Yeah, absolutely. Like you said, pet ownership, it may not always be feasible for certain people, particularly as people are aging, maybe or they're living in certain places that don't allow or something like that. But fortunately, there are still a lot of ways that you can experience that human animal interaction and capture, those health facilitating benefits. And, you can volunteer at an animal shelter. There's plenty of need in those settings. And we mentioned a little bit a dog park too. But like you do not have to have a dog to be, have an enjoyable time in that setting. They're great for socializing even without a dog, but just go plop down on a bench and I assure you, you will get a dose of pet therapy while you are there and also just great socializing with other people. You can offer to house sit or pet sit for family and friends while they travel if they're gone. Um, I know there are, local horseback riding outposts, and you can go enjoy a trail ride. Um, there's animal rescue organizations. They're always needing foster animals. So if it's can be maybe something more temporary that you could entertain. Also, I know that there are several local dog walking groups. Again, sort of like the dog park, you don't necessarily have to have a dog. You can just a lot of these groups they just post an address or a park or a trailhead that they're meeting up and you hop out and you get a walk with a group and they're welcoming whether or not you have your own dog or not. So that's certainly another option. And also, kind of moving in, looking at the future, so there's these virtual reality exercises where you are virtually walking a dog or, good old fashioned YouTube, right? Taking a little bit of time out of your day to watch some uplifting videos of animals online. All of those things can sort of get you a step closer to that human animal bond, even if you are not, owning a pet at the time.
Lots of great creative ideas here. And I'm just having a flashback. I remember going with my kids and some family members to a cat cafe. And we
I love
just
it.
hung out in a room full of cats that were climbing all over everything and everyone. So, and it's funny, it's bringing a smile to my face just thinking about it.
That's
I've asked you a
awesome.
lot of questions today. I'm wondering if there's anything else that you would like to share that we haven't covered at this point.
I guess I could tell just a little bit more about the dialysis study that I referenced. This is probably one of the most exciting things I've done here in my work so far at UT. We actually partnered with US Renal Care at a local clinic here in San Antonio, and we decided to do a pilot study to see, if we set up a regimen where patients get either one or two dog visits a week. at the clinic, right, in the waiting room immediately prior to their treatment, is this something that could benefit them? And so when I say benefit, we looked at an objective and then also some subjective ratings. So we looked at basically, did it help them miss fewer dialysis treatments? And so this particular treatment is, on average, you get it 3 times a week for about 4 hours. And it can be a really kind of grueling physically and psychologically care regimen. And missing even just one appointment can have health consequences. So that's why we decided to make that really the primary outcome. And then, like I said, for the subjective outcomes, we also looked at, patient reported outcomes. So pain, depression, and anxiety were probably our three major secondary outcomes. And we basically compared and this was a small pilot, right? It's the first time with dialysis, having dogs in the dialysis clinic. We looked at the 3 months leading up to when we introduced the dogs. And, we had that historical data on number of missed visits. We introduced the dogs and then watched, did it change, right? Their number of visits. And what we actually found was, even in that little, relatively very small sample, we saw a 76% reduction in the likelihood of missing one, treatment per week. And so it was highly statistically significant, and those secondary outcomes also improved. Their pain and depression and anxiety improved immediately right after meeting with the dog, and also over the course of the study too. So we have some really, really compelling, exciting results. And so I definitely want to take that to the next step and move forward with that line of research.
That's incredible. And thank you so much for expanding on that, because a 76% reduction of, you said, missed appointments, correct?
The likelihood of missing. Yeah.
Yeah, which is pretty stunning results, in addition to a decrease in pain, anxiety, and depression.
Yeah.
So those are great outcomes, and great outcomes that can be achieved by the human-animal interaction. So thank you so much. As you heard from our expert guest today, human-animal interaction has a plethora of positive effects on our well-being, including physical, social, psychological, and physiological benefits. Dr. Stensland, thank you for joining us for our podcast on the power of pets and for making lives better by sharing your well-being wisdom today. Tune in next time when we discuss the importance of relationship health. Until then, please take good care.